Good day, global citizens. Welcome to another episode of Dr. Fajembola's Opinion. On this episode, I bring you a colleague. I guess we did West African Institute of Public Health together. You were an intern.
Yes.
This should be the third or the fourth person I'm bringing from the West African Institute of Public Health. And I'm glad he's the person to take us through the topic for today, which is diarrhea diseases in Nigeria. Diarrhea is very common, and I'm sure I'm glad the aspects Mr. George is going to bring on diarrhea diseases on this discussion today. Please join me to welcome Mr. George NSIKAKABASI. Hope I mispronounced your name.
I'm actually really glad. I mean, like the way you actually pronounce NSIKAKABASI. I mean, that's absolutely very good.
Thank you so much. When I see your name on social media, I'm like, actually, I don't call you George. It's NSIKAKABASI. That's what is on my mind.
I mean, and it's actually my first name.
The longer one, actually, but that was on my mind because I'm a bit attracted to traditional names. So that's what actually is on my mind, not George or Samuel.
Yeah. I mean, Samuel is my dad's name and George is my surname. So I actually really love it. Like when people are able to pronounce my first name, like it gives me so much joy when someone says NSIKAKABASI. I'm like, I mean, that's very good effort really putting in to pronounce this name. Indecisive of like what I was gonna choose. And I remember one of my uncles at the time was like, oh, there's this course called public health. And I was like, okay, so what about it? He just said, you're going to travel a lot. That was just the thing that just sold me to public health. But I think looking at that, like that journey, like from that time until now, and I think the work that I've been able to do have also spoken for itself, like where I have, found myself and been able to contribute meaningfully to public health, whether it was in Nigeria, whether it was in Europe, or whether it was in Asia. Just doing a couple of things around policy, around programs, implementation. It's really been beautiful. I think I would always tell my friends that even if I was to die today, of course, which I'm not going to die today, that I would still feel very fulfilled that because of some of the work I have done, I would say children have actually had access to that's essential medicines, essential healthcare. I would also look back and see that, okay, the girls in Sokoto, really did have access to HPV vaccines, or children in places where they would otherwise not have, received healthcare, because of the effort which I've put in, and also in collaboration with other professionals have really helped to push the needle and help these guys receive healthcare services. And I think I'm also really overjoyed, like when I also get feedbacks, from people like, oh, the work you do is very inspiring, and they see that it actually motivates them to do more. I see, of course, other young meet professionals like myself say that, and it's really just beautiful, and it just gives me so much joy, and also hope for the future that, well, things can be bad, but things can also be better at the same time.
I don't think it's true. Because I use ants to eat a lot. In fact, my spouse was saying it yesterday. I was eating rice and I was using my hand to eat, and it was like he saw someone that was eating somewhere and the person was hiding because they were eating with their hand. Like, he was like, why are you ashamed of eating with your hands? And I feel eating with hands, we attach so much stigma around eating with hands. The current to-be mayor of New York, Mamdani, one of the point I was used to criticizing during the campaign period was like, how can a future mayor of New York eat with his hands? Like, it's barbaric. And people forget that people eat pizza with their hands. People eat fries with their hands. Like, when we say eating with hands, people just attach it to a specific kind of food, like local food. Why? Countries.
Exactly, I get that.
Wings. People are licking the sauces from the wings with their hands. So I don't know the kind of, I don't know how we are trying to show that we are different, special from others. So the last week I don't agree with it too, that eating with hands increases diarrhea as long as your hands are.
You said about India, I'm someone that really loved the Asian continent a lot. I mean, I lived there, and it's one of these places that gives me so much very good memories. I ate a lot with my hands when I was in Malaysia. That's of course a spoiler. And I think it's just also beautiful, like what you just said, about, okay, if you eat, I mean, with your hands, you're gonna have the disease more. But I think this is really just the myth, that are just associated, like with diarrheal diseases. Usually, it's just very important to actually see, like, what are, I mean, the main risk factors, first of all, like, of this disease. Of course, we know that poor water, sanitation, and hygiene is a very big thing. So it is not in the using of your hands, to eat that is the problem. But just as you said, like, are you actually eating with clean hands? The food, like the way it was prepared. I mean, was it actually in a very sanitary condition? That things like that. Now, you also maybe consider like other risk factors. Let's say, for instance, malnutrition, which is something that is very predominant, let's say, in a couple of countries in the global south. And, one thing with malnutrition, mostly you would see them in children, let's say, that below the age of 5, right? And usually when a child, has malnutrition, maybe wasting, stunting, underweight, this disease, I mean, this particular condition already weakens their immunity. So there are things in which the body would naturally, I mean, just help you protect. I love this theory very much. When I was back in medical school, where they would always say that, everyone walking actually has TB, but the only issue, or the beautiful thing, is that your body actually prevents you or protects you from having it, because you're not at the point where your immunity is really low for you to actually see that manifest. So if, let's say, a child is already malnourished, that already weakens that child's immunity, and that child becomes much more susceptible, to whatever bacteria or viral infections they are, to really manifest. And then let's also see something like low exclusive breastfeeding rate, and then also a couple of other environmental factors. For instance, you talked about eating, right? So if you're eating in an environment that is actually really dirty, let's say, there's also the big issue with open defecation, right? So if, for instance, you're in that kind of place, it's not even in you eating, but it's actually in, the pathogens and all of the organisms just moving around. You're eating this food, and then there's a fly, that perches on something and then takes that to the food that you're eating. So you would definitely be susceptible to getting that, even if you're using a spoon to eat that food, even if you're using whatever you're using to eat the food.